Welcome to the Recovery.com podcast. I'm Dr. Mala, your host, and today we're honored to have Dr. Aldarondo, Executive Director of the Melissa Institute for Violence Prevention and Treatment, on here with us today. He has over 30 years in the field, has definitely many prestigious awards, and I'm so honored to have him on with us today. Welcome, Dr. Aldarondo.
Dr. Mala, it's a pleasure for me to be here with you. Thanks for the invitation. Looking forward to the conversation.
Of course, of course. So, congratulations. I heard recently you got a Lifetime Achievement Award. I'd love to start there. Can you tell us a little bit more about the award, and then let's go into talking about the Melissa Institute?
Yeah, I'll tell you. You know, the real meaning of the Lifetime Achievement Award is that in spite of the genes that made me look good, I'm not really that young. That's really, that is really, and no, it's all jokes aside, it was I was really honored and moved by this recognition from IVAT, the National Violence, Abuse and Trauma Association, basically an organization. They've been in business for many years, nearly 40 years. Do wonderful work, and so the Lifetime Achievement Award was for family violence advocacy, and which is, if you think about it, it's not the type of things that academics we get recognized for. So when they called me to inform me about that, it really made me think about really my trajectory and the many ways in which the things that they interpret to be advocacy for those in need. And the truth is that I have, in a fairly intentional way from the get-go, intended to use my privilege in academia first and then in other jobs to try to help move the needle and to benefit those who are less fortunate. So it was really, really moving to me. I have former students of mine were there, colleagues who saw me from the very first conference when I start talking about the work that I was doing, and some of them who really poked me into basically looking beyond the academic career. Listen, there is a place for you at the table. We need somebody like you to represent the voice of our communities and to help us really connect the dots. And at the time when all this happened, almost nearly, when all this started, almost, we're talking about the late 19, the late 1990s, more or less, mid 90s. They, I happened to be the only Latino PhD who was working on issues really of domestic violence, and then I had the fortune of joining others who were doing wonderful work. Anyhow, so that was the award, and it was really, really, really a fantastic experience. Just happened a couple of weeks ago. So
that's right. Congratulations, and so well deserved. And that's such a good segue to kind of start again at the beginning. But I was very excited to see that message that you won that award. So I definitely wanted us to talk about it today. Let's talk about the Melissa Institute. Well, actually, let's talk about your journey. How did you get into this whole field, and what inspired you? What motivated you? For our audience, can you explain a little bit more of what you do? And I think that the journey that you've had will help with depicting that as well, elucidating.
So I'm going to briefly just tell you where I am right now, what I'm doing, and then I kind of like go back to help you understand the journey as you asked. So I'm the executive director of the Melissa Institute for Violence Prevention and Treatment. We are here in Miami. And the Melissa Institute was created nearly 29 years ago, following the murder of a young woman named Melissa, and who was really coming out of a social event on a Cinco de Mayo celebration with a friend in Missouri. She was a student at the university, Washington University in St. Louis, and had the unfortunate situation that she crossed paths with folks who were intending to really take her car away, to steal her car. Melissa and her friend were abducted and shot. She was she was killed, and her friend was left for dead. Fortunately, for her friend, she was able to recover and participated in the process of identifying and then bringing to justice the perpetrator. The Elisa's parents, who are one of the best human beings that among the best human beings that I have had the opportunity to know and work with. Uh, they decided to turn their grief into good for the world, and by not by really competing with other organizations who were working on this, but really by strengthening how other organizations work and by providing the tools also for policymakers and professionals so that they would have state of the art knowledge on how to prevent violence. And that's what's been our mission pretty much from the get go. An unusual mission for a nonprofit, especially if you're thinking about nearly 30 years ago. Then they decided, we're not going to provide direct services. We are going to really bring the knowledge that people need to know on the belief, which was true then and is even more so today, that violence is preventable. We know what needs to be done, that the knowledge is there, the tools are there, and that we, in part, need to disseminate information to the appropriate through the appropriate outlets, and also we get to do the work and get the political will to move the needle and do the things that we know that work. So that's what I do. That's what I do right now. And so let me now go back to the story is like most stories go, more nuance, a lot more nuance than that. Um, it almost, there are days for me that it seems that this is what I was prepared to do from the get go. So I'm the child of a social worker. My mom was a social worker, and she was a drug rehabilitation also therapist when I was growing up. And my father was a political scientist. They're both in Puerto Rico. He was by far the smartest person that I know. And having dinner with him every day was like going to a dissertation defense.
I believe it. Yeah.
It was like always really,
Yeah.
and if you know anything about politics in Puerto Rico and especially the intellectual life of young people at the time, they're consumed about the political status and things. And so it was, I was way above the average in how literate I was about political issues and thinking systemically and thinking about hidden interests behind decisions and being aware of all those things. In fact, he was also, for many years, also advisor and very close to the governor of the island. And I had the opportunity, a repeated opportunity, to hear them talk about things while they were playing domino that would then come out on the news the next day. So for me, they were like, wow, and I could tell that what they did really mattered, and that it was possible to change things. My mom, on the other hand, she would frequently take me with her to barrios and neighborhoods in Puerto Rico where not even the police didn't want to get in there. They were dangerous, but there might have been a couple of days that she had not seen a particular individual client that she was working with, and she would go there. And for me, it was amazing because these were really presumed to be very dangerous places. And she was treated like a queen there. Everybody knew her. She would hug everybody that she found on the streets until she found a person that in need. So I grew up with this opportunity to be in touch and aware of the suffering that people, and then discussions and awareness too that there were ways that and access to power, and there were things that could be done to change the conditions that affect that suffering. So that's, and of course with that combination, I thought I would be a lawyer, and but neither my mom nor my dad kind of like thought that that was the best career for me, and they both told me, while you get ready for this, why don't you go and study psychology for a little while? Because they both thought that it was perhaps It was a new field for them, and they thought, I think you would do good in that. And I had the fortune then to meet other folks who felt that way too. And Jay Efron at Temple University, a mentor who not didn't do any of the socially related work, but he was the one that when I went to ask for the letter of recommendation for grad school, for law school, he said to me, I will write the letter. I think you'll be a fantastic lawyer, but I want you to know that I think you'll be a great psychologist. So he came in with a list of schools, and these are the schools that I think. Anyhow, so that set me up in a different direction. Met other mentors there, Howard Gadling at the University of Massachusetts, who was talking about things like I never heard before. Foucault. He was talking about Foucault, Martin Barreau. He was talking about things like, I said, who's this guy and who is he citing? So I became a consumer of ideas that really resonated with me. Meanwhile, understanding that the field of psychology that I was being trained to be part of was inarticulate about most of these issues. That they were very, very good at the understanding of individual suffering, but not how the nuanced ways in which the pathology was related to the toxic conditions of everyday. That became my own kind of like homework all the time. And it's been since, honestly. It's been since. I don't know how, if you want me to continue the journey.
So this is so good. So this might also be a tie-in to your wonderful book that is sitting behind me here. It sounds like very early on. I mean, of course, we see the roots of it as inspired by your parents, but then you get into this world. Now you're hearing, you're taking in all the information, and you're finding your passion. And in the book, you were definitely describing, kind of the history of these professions that are providing. Can you, for our audience and those who may not know, give us a little bit of context to what social justice means in this mental health arena?
I'll tell you, and let me just fill one gap in the story there, because I think though I encountered socially minded thinkers and clinicians who recognize in me a genuine commitment to these issues. They gave me a lot of kind of like freedom to move and do things in a different way, think differently. They mentor me, perhaps in ways that they didn't get to do it. I mentioned Howard Gadlin. I mentioned, I haven't mentioned, but I'll tell you now, Carlos Lusky was another one who directed the Palo Alto Mental Research Institute at one point, and was like one of the renowned family therapists at the time. These were systemic thinkers who actually felt you. I don't know where you're going. We'll support you with this. So by the time I get my degree and I start working at the Cambridge Hospital in part of Harvard Medical School as a psychologist. So my first job was as a psychologist at Harvard. I made it. This is it. Then at that point, it became very clear to me that what I was doing was a little bit different than what some of my colleagues were doing. And I learned to appreciate a lot of many of the things that they were doing that I was not good at, like assessment, testing, and things like that. It was fabulous to see testing being done by an excellent clinician who was doing that. And at the same time, I would tell them, I would add these comments about other things that were happening in the client's life. And they would look at me like, hey, wait. Then, because I could see that there is a space for awareness about these issues for the benefit of the clients that we're trying to work with. And we need to do something to change those conditions. At that time, I was had the fortune of being offered a position a couple of years later at Boston College. That had this, being a Jesuit institution, had decidedly kind of like a stated commitment to social justice issues. And so I felt, okay, if they really mean it, let's do it. And the book that you have behind you there now was in part the result of, after I taught my first couple of classes there, with the students there were like, they were talking about what they were hearing. So they were curious. The administration was excited. And the students were saying, how come I didn't hear about this before? I almost have a PhD, and this is the first time that I hear about these issues. So I said, so it was we're very critical about the way we're being educated, and a book was produced with the editorial support of 5 graduate students. What we did was I had created through my graduate school years a file that I called the truth, and in that file I included articles, authors, op-eds, things, ideas that I thought this is the truth. This is the truth about understanding individual suffering and the social conditions that are the toxic conditions that are affecting this. And perhaps there is a way out of this. I didn't know how to deal with it, but so I went back with and we wrote back, try to identify everybody that I had on my file who was alive and inviting them to talk about it and perhaps put their thoughts in writing. And many did. The ones that are, it was a beautiful process just to put it together. And the students then became the deciders. They were the editorial board that decided whether the authors were really explaining things in a way that it was. Anyhow, so now going to your question specifically about social justice, even though I do, like many people, I do have a moral framework and commitment that in which it fits in to think about it that way. My way of getting to social justice really was much more pragmatic. I got to it as a scientist, honestly. I was a, I was a distinguished undergrad student, and I was a TA in statistics. I was doing the I would think a hardcore in the science part. I was being prepared. In my mind, I was going to take over by doing it better, by designing the studies well, by dealing with issues. Eliminating the confounding variables, doing this. And then it was really that approach that helped me realize, wait. The if you think about the variance accounted for, like what is it when you study anything? How much does that account for the particular? So for almost anything that mattered, the majority of the variance was not accounted for. I said, okay. So, and started reading a lot more of what has become more like a public health field, anthropology, and others. Because in there I found a lot of things. Okay, this is a lot of where the variance unaccounted for is. This is stuff that we need to really at least be conversant about, know about it, and how understand how it affects our work. So that's how in my view of social justice is pragmatic in that way, in that I think it makes all of our work more effective. It makes the work of the cognitive behavioral therapist more effective. It makes the work of the family therapist more effective. It makes the work of the psychoanalytically oriented therapist more effective. Because if you otherwise you end up doing therapy with one hand tied to your back. What I used to tell my students. So why would you go there with less than you can? Why would you not offer your clients all of it? If you know that they have lost repeatedly a job, that they have a history of keeping jobs for about 3 months and then doing this and that, and let's deal with that job part. What is it? Is it that they are not doing the type of things that they don't match with that career aspiration? Is it really because you know they are choosing areas in which they're not welcome? Would it be that you know, we used to discuss and in supervision, and I would always be interested on the address where people lived in the neighborhoods and I said, where do they live? Where do they live? And so if I saw one client only from one area, I felt comfortable with the idea we're dealing with, perhaps with the depression, we're dealing with this. If we began to get 2, 3, 4, 5 people from the same neighborhood, the same building sometimes, and then I would ask the question, it couldn't be possible that they be demoralized, that there are other things there that are really affecting. They are affecting the likelihood that they could live a life worth living. Maybe perhaps because I didn't know. I wasn't like I didn't have all the data. I said, but perhaps we should go and explore those things too. Perhaps we should leave their office and go and visit them at their homes and see what they're doing there, which is It's a trick also that I was taught at the Philadelphia Child Guidance, where I had an opportunity to work with a program where you go and visit people at home. And I thought, that's amazing. I mean, I was being in West Philadelphia, being in those neighborhoods that had nothing to do or very little to do with the way I grew up, but it had all to do with the neighborhood, with the life of the people that I was trying to help. Really, for me, it was transformative going to Baptist church. I remember telling a client, that I was doing that because the word spread around. And this client said, if you really want to know about my world, come with me on Sunday to church. So I ended up going to the Baptist, Black Baptist church in the neighborhood. And it was a phenomenal experience. And I'm not a believer. I was there. It was really a cross-cultural experience for me, an enlightening experience for me, a necessary experience for me. And I think for all clinicians who claim to be working with populations like that. Anyhow, so does that answer your question?
It's so, yeah, absolutely. I mean, it's so true. I mean, the heart of it all is we need to unshackle ourselves. And certainly one of the ways to do that is through the curriculum. So, what would you recommend to fellow professors, supervisors, clinicians? What can be done to help with unshackling?
With a lifetime designation, humility also comes with that now too. I don't know. The field has really moved in important ways in the right direction. Give you a little piece of information. When I started graduate school, there were no multicultural psychology courses, so, and that conversation was really, it was really interesting to begin to have that conversation. And for people, it's not that it was not considered important, but it's important people. There were people doing the work, but the profession not embraced it. The professional psychology, the accrediting boards had not really gotten behind it yet, and so that took some time. Not surprisingly, that happened as more of us got the degrees, move up through positions of power in APA and other places. Not me, but others. Other important people, and so as that happened, then the field matured more because it was taken there by people who understood that this is really something we need to do. It's not something you need to do over the weekends on your voluntary time. This is something that needs to be infused in our training. The same happened with gender issues. The same happened, later on with LGBT issues. By the time I left graduate training and many years after that, there was no conversation about LGBT. And I remember trying to be catching up all the time what it is that we were talking about. What are all these letters mean? What are we doing? So yes, and so I do have ideas about what can be done. I think a lot of the curriculum things have been taking place in many programs, like infusion of the requirement that they develop multicultural skills, the requirement that they also develop more systemic ways of looking at things, that they go beyond the individual, and that they develop skills to deal with other systems, couples, the families, the individual and their context. I did some things that at the time that I thought were very unique, and I still think about it. I was reminiscing about some of this in San Diego the other day with one of my students, and at one point I got authorization to teach one of the seminars that I was offering in a community center. The idea was, I thought the stuff that I'm talking about, the students are saying we've never been exposed to this. So I had already the fortune have worked in a community center prior to being an academic. So I knew that people in community centers, for them, they would recognize this right away. So it was like so I thought it was an issue almost of legitimizing to them that this is the reality. I am not making this up. But also it occurred to me, this is a way of really helping the boots on the ground folks who are there, providing them even more affirmation and tools for them to. So we began to kind of like do those seminars, and it was a beautiful experience. Students got to hear the cases and the situations presented by frontline workers. And in that particular case, it might have been Dorchester, but I'm not remember well the town. And and it's and be able to see how is it that you think about it. Cases like these what Minuchin used to call multi-problem families. Very simple. If you want to, that very first book by Minuchin, and which I made me title like that, I forgot it right now. That is really that's what happened. He came from Argentina. He doesn't have a license to practice as a psychiatrist. He gets to work in the neighborhood in Philadelphia, and the families the clients that are coming in, he says, wait, these people have multiple problems. This is just not. That was very simple. So why don't we develop a way of dealing with these multiple issues that are affecting their lives? And that was the basis for the development of structural family therapy. And anyhow, and the emphasis on hierarchy and power and all those things. I mean, all that comes from his observations of these families living in that kind of like in that cognitive dissonance space, with I would recommend. Let me go back to that. I would recommend in part that kind of experiences that take the students closer to what is happening in the communities that they aspire to serve. I think I think the any opportunity that helps students become literate about the isms of life, sometimes in our efforts to be more scientific or be valued as scientific in our approach, we have confused that with removing the isms from the conversation. So, because they're messy, they're really messy. To talk about sexism, classism, racism, all those things, it's really messy. That's not really a conversation that it leads to very precise language sometimes. But it's one that if you eliminate our ability, if you don't talk about all those isms, you create a mute therapist. You know, the therapist is only able then to identify symptoms, identify signs, and then appropriately intervene, which is okay on the basis of that area for which they feel comfortable and they've been rewarded to develop literacy skills. The issue is that other knowledge, that capacity to converse about all of that, it's going to allow the clinicians access to the other players who could be at the table helping with those isms. So it's not that we as clinicians need to be superheroes and kind of like is that we need to know how to set the table and how to engage others so they understand that they have something to contribute to the well-being of this individual, to the development of this family, to the kind of like the growth and thriving of this community, and that there are others who are committed to do that and would be happy to work with them in this process if they call them to the table. So this is
you're touching on it so well. The isms, like there's a fear that is ingrained arguably even before school, but certainly just continued throughout the lifespan of an individual to be able to even talk about them. And I think that's one thing that I'm thankful for now is that we are living in an era where talking about things is happening. We're starting to see that more, right? So I feel that that does contribute to the unshackling of, the limitations I think that we have faced in the progression of our field. What would you recommend to help with destigmatizing? You mentioned increasing literacy. That is actually one of our missions at Recovery with Recovery Media and at Recovery.com is to destigmatize, right? To make this information accessible, whether you're a patient, a provider, a loved one, what have you. So we're trying to talk about it. We're trying to improve that literacy. What do you think is needed to help with the destigmatization and the increase of literacy, access to that literacy?
well. I mean, some of the ways in which I look at some of the things that some of the ways in which some of my teachers, perhaps some of them intentionally, some of them inadvertently, did that with me. I really didn't know who Samuel Beckett really was. I was raised in Puerto Rico. I was educated there, and but it was a professor of psychology who insisted that we read all this Samuel Beckett things or this or that and plays and drama and this type of drama that is laced with a social commentary and all that. And I got everything that I read in those classes really stuck with me. It's really changed the way which I thought and taught me how to engage others in this. Because one thing is to read Waiting for Godot, and like I did, I adapted it to fit the book. Like yeah, we're waiting for the one solution that would really help us deal with people. And meanwhile, pathology is showing all around us. But one thing is to just to read it as a novel, as a drama. One is to kind of like begin to see and to find ways. Yes, this is a way I can communicate some of these ideas that the others who have been trained or do not have the skills yet to do that would really identify as important and potentially useful. So for me, the arts are important. And the exposure, as I mentioned before, to the work of others. A little bit cross reference education in other fields. I think important. I think for me personally, it was always, I would say, even more important to read about anthropology and to read about sociology and to read and than to read about psychology. You know, I found it. I learned at the time. I remember feeling a little bit, and I talk about humility being something that came later in my life. So, when I was a student, I would read the psychology papers, and I thought, okay, I got the abstract. I got it. I know what this is. This is, I didn't feel like it was really. There were not many lessons there on how to be a better person. Let me put it that way. But as soon as I deviated into sociology, social psychology, like anthropology, then we're talking about how to be a better person, how to be authentic, how to be in relationship to others. What are the price that you pay when you're not doing it? How to affect the behavior of others. Then all things that I thought, of course, had to do a lot with how I deal with others and how I would help another person who's in pain in front of me and how I would really help them move to a place where they're more comfortable, where they can risk taking steps that are difficult in their lives. So anyhow, so I hope that gives you an idea.
Yeah, no, this is really great. So, probably a good place also to kind of shift gears and talk about trauma informed care, which is such a big part. Obviously, you did all of these things, you're advocating for social justice and informing yourself. So, now we're in this realm of trauma informed care. And I know the Melissa Institute, of course, does a lot around that. Can you tell me and also our audience a little bit more about that?
So yes, we do. By the way, in terms of formal things, and the Melissa Institute, we're taking leadership in the area of preparing everybody that we can talk to about trauma, the impact of trauma in people's life, and kind of like what you can do as somebody who come in interaction with those who have may have experienced traumatic experiences. What you can do to really not only re-traumatize them, but also to support their healing process, even if they're not in a contract with you to heal. There's things that we can do. So it is really about an attitude. It's about a way of approaching others that, in my mind, um, assumes that the level of suffering of out there in our communities is much higher than we even like to that we can bear to acknowledge, you know and that we do well assuming that by and large we are really interacting with individuals that are really going through a very difficult situation in different parts of their lives, not in all of them. Because as we like to say in the institute, there's a lot of trauma, but so is a lot of resilience. Thank God, we really people that the people's ability to manage difficult situations exceeds our capacity to predict their ability to do so. I mean, they're really incredibly resourceful. Now, but for me, with the trauma informed care, the development of this way of thinking, it's I when I first heard about it and began to see it going on in the field. I was at that time doing more of administrative work as I was associate dean of research here at UN for a while, and then in the School of Education, and then I was a provost at another university. And so I wasn't really doing the work day in and day out, but I was paying attention. I thought, this is a language, this is a framework that allows us to for people to understand all those other factors that I talked to you that create the toxic conditions in a non-threatening way, you know. And when let me tie in one of the things, a comment for you. When I first put out the books, Advancing Social Justice Through Clinical Practice, the first book that reviewed the book for considered for publication, wrote back a wonderful kind of like letter. They said they were interested in. They have one recommendation, which was to change the title. And I wrote back. This is before the emails and all that. I wrote back. I said, I really I understand your concern, but if you feel that strongly about that, then maybe I need to look for another publisher. I don't think you understand what I am saying.
Right, right.
It matters that we call it social justice. This work, I didn't create it. This work, as like the book documents, it's been going on in the field of social work, in the field of psychiatry, in the field of clinical psychology for decades. It's been going on for decades, and it's been marginalized and not recognized, and not the knowledge not formalized. And that's why we are where we are. We need to really call it what it is, understand that some of the greatest minds in our field are working on this. These are not people who were just doing this in a careless way. These are really well thought out programs, ways of thinking about it. Anyhow, and and remind me now, what was the thing that I was saying before that?
Well, we're talking about trauma informed care, and yeah.
So we go from that point. When I see this language develop, and I could see the response of us from the left, the right, the middle, people, they feel comfortable with this. It creates a lot of anxiety on a lot of people too, even to this day, because it's like, so what do we do? What is it? It's if there's so much of it, it recreates what I used to tell my students about. What I used to call the social justice blues. Like once you really, if there so much is against the, increases the probability that things will go wrong, or so many stressors. What are we to do? So that's a risk that you have when you emphasize too much the story of trauma in the absence of the story of resilience and the research on resilience. So we're trying to strike a balance on that, in that regard. So yes, this conversation is now recognized literally a minute before I joined the podcast. We're in the phone. We got a phone call from I only took it because we have a great deal of respect for the state attorney's office, and called in, and because they want to set up some trainings on trauma informed care for their lawyers. So that gives you an idea. So that's what and we've done it with judges that work with the youth. We've done it with clinicians. And now we created a coalition. It's called the Miami-Dade Community-Based Miami-Dade Trauma Informed Care Community-Based Coalition, and we do it in partnership with the Department of Rehabilitation, Corrections and Rehabilitation. And our mission is to train every provider of human services in Miami-Dade County, every provider, on trauma-informed care practices. So we're creating kind of like an army of trainers that could really go out there, because obviously this is not there's no need to compete when it comes to this. We all need to be on the same board. If you are working with a client, if we know that there are multiple, this families, these individuals we're working with have multiple problems. So if you are a provider and are working with them, I would like to know that what you're doing is done with an awareness of these issues, similar to what I'm doing in this other area. We don't need to be coordinating day to day. So I need to trust that you understand that trauma is an important consideration when we're working with the same people, and that we can support each other's and the progress of the person in by doing it that way. So anyway, so we're very excited. We're doing this all over. We if anybody who watches your listens to your podcast is interested, they simply need to reach out to us. We'll be happy. We're creating materials. We are providing them out for free for people, curriculums. We're working on that, and there are other resources too, of course. And part of what we do is identify resources and make it available to others. There's a lot of good people doing good work about this across the nation.
We'll definitely be including that in everything that we put out. So absolutely. I have to touch on them. But first of all, thank you for that wonderful work that you're doing. And it's exciting to hear. I think, one thing I want to touch on is like so many people think when they hear recovery, right? Recovering from what, right? And an easy place to land is on maybe one facet, right, of recovery, not looking at it holistically. And we have research that tells us that whether you're, recovering from substance use disorder or from a trauma or from anxiety or from depression, whatever, we all land in this place of needing that informed care. In fact, research is telling us what, like, if you have substance use disorder and PTSD running comorbidly, right, you can treat the substance use disorder, but that's not necessarily going to help treat the trauma, right, the PTSD. Whereas if you treat the PTSD, that will help the substance use disorder. And I believe, like we need to start having these conversations and, sharing this type of research to be able to help the general population understand that recovery isn't just about one thing at a time, right? That we need to address all of these different options that are there, different experiences that we've had, and really look at it from a more holistic view. And so really reinforcing the trauma informed care the way you are is a wonderful thing because again, I've had meetings I know with fellow clinicians where it can be a scary thing to touch on, like I don't know if I feel confident to be providing care in this way, for trauma. I've heard that amongst clinicians. So this is an amazing resource and I'm excited to include it and I'm excited that it's out there. Can you tell me a little bit about what you feel? I know domestic violence is part of the Melissa Institute as well and one of the things that you advocate support for. Can you tell me a little bit more about how that advocacy is working and what some of the common misconceptions are about domestic violence that you encounter in your work and how that even relates to trauma informed care?
I'm going to ask you to repeat the question in a moment, but your last comment made me think about something that I wanted to add in terms of the recovery. And a dear colleague of mine and my former dean here and an international leader in the field of community psychology and a member of the Melissa Institute, Dr. Isaac Piretensky, has written extensively about the relationship of individual, relational, and community well-being, and about the necessary synergy that needs to take place there for us to thrive, for us at the individual, relational, and community levels. And so I invite people, and I'll be happy to send you some sources later. He has a TED talk on the topic and all of that, and the folks are. I invite him to take a look at his work too. But I think it's a not a lot of folks are talking in an articulate manner about the relationship between individual strengths and weaknesses, relational strength and weaknesses, and community strength and weaknesses. And I think again, it's a framework. It's about having the ability to know what you know and not, and what you don't know, and know where to go get it. As a clinician, this is perhaps the best gift that we can give to our clients. And now back to your question. Repeat it to me again.
Yes, absolutely. No, I love that. So we were talking about trauma-informed care, and I know that domestic violence is also part of one of the facets that you address at the Melissa Institute. what are some common misconceptions about domestic violence that you've encountered in your work, and how is Melissa Institute kind of navigating around those misconceptions?
The knowledge about domestic violence is consumed by a new set of characters every so often. Kind of like these people, it's I'm talking about the population in general, So the some of the misconceptions are repeated over time because they continue to be with the a newer population of people who have been exposed to the issue, and they emerge again. Sometimes very basic ones is what is she doing? In the case of intimate partner violence, how is she triggering this? How, I mean, it sounds like we shouldn't even be talking about that anymore in 2024, but it is when you are new to this, when you're in the community, when you see young couples dealing with it, and when you're trying to make sense and you're not an expert, it is a common framework, it's a common way of understanding that takes you in one direction and not another. It takes you away from the direction of seeking assistance and identifying as a problem, reaching out and supporting the victim when that's happening, reaching out and perhaps also redirecting this young man's behavior and kind of like assert your kind of like seniority and to say, listen, there are other ways. Let's deal with us. Help you kind of like assume your role of citizen, and that is also there to protect him as well as her. So some of those limitations or misunderstandings are like that. Like that the women really are an active and participant in the creation of the problem. Albeit that they're contributing ways too. Everybody in a relationship contributes to things, but nobody contributes to their own victimization that way. Some of the most pervasive ones too are like, there's nothing you can do
Mm-hmm.
to deal with it, and so that is sometimes difficult to crack through in the general population because again, people, they know the cases that they know the neighbor in which somebody got really hurt, the police intervened, they know what they read in the paper, they know about the murders, they know this. What they don't know is about the other 70% in which the violence occurred behind closed doors and other things, and for which a large percentage of them, for different reasons, they have taken steps to really move away from the violence, to find, hopefully in some of the cases, also find out ways of living a life that is worth living without violence. So we don't go announcing that. People don't go announcing that. Uh, there's no reason to celebrate that either. Obviously, there's no. I'm not saying that that should be celebrated, but it helps perpetuate because that's information that we get. We get only knowledge. We get told about what's really. The press releases go to the really more tragic situations and very little to the resolutions, which are many, and which are many. So that's a significant one that sometimes cripples all the way down to the provision of services for men who batter, because then people inadvertently have the same bias when they are evaluating the data about the effectiveness of intervention with men who battle, which is something that I had written and talked about for years. If you know that 20% or 10 to 20% of the abusive men account for over 80-90% of all the injuries, so you have a specific group of people that you have to target with. That not all these other men are at the same level of severity, and perhaps that you deserve particular interventions for that group that are the same, and so things like that happen when you characterize the whole population as in the way that you would characterize that 20% of recalcitrant abusers, then you run some risk of not really helping as many people as you could and not protecting as many women as you could, etc. There was many years back, and that led to the my dissertation. I'm going back to 1990. What was that? 1990, 1991, I think. So I was very curious. As I told you, I thought of myself as a serious scientist, and I was dealing with this. So I was evaluating. I got very interested as a clinician. Then I got interested on domestic violence because I was asking every couple that I was working with at the time in the Berkshire community, Berkshire Hospital, and the center, family center of the Berkshires. It was the name of the place, and I was asking them about their occurrence of violence in their intimate relationship. And to my surprise, large numbers of them began to tell me that there had been violence in the past, but it was not. It was water under the bridge. I remember learning the phrase at the time because a client said it's water under the bridge, and I said, "Huh? What does that mean?" and then and then I began to look. I went to the literature. Like, let's learn more about this population. Let's learn more about, because I thought obviously for sure we know more about what happens with this, what the effects are, and they did not exist in the population. So I was like, okay, that could not be. I could not be. It could not be that I'm the only person who's really having this, coming into contact with them. So I went and I reviewed every single study that I could find my hands on that had really recruited violent couples or men were the who have been abusers, and I looked at the exclusion criteria for the study. And sure enough, I found out that they would not include in the studies any couple where they did not report violence in the last year or so. So they were actually doing good science by trying to get a good sample that it looked more like a show, eliminated the people who it's like the biologists who studying a mutation, studying a new seed and how to reproduce new seeds and throws away the mutations because and when the mutation, what a biologist does is when that happens, they go and look carefully at the mutation. So what is it about this plant that makes it survive in this environment, so to speak, if that's the case? So that's what I got began when I realized that, and the number that came up at the time, it looked like 40% of all couples had ceased the use of violence for at least a year or so. So I went on and I wrote my proposal to the Ford Foundation on the basis of that twisted analysis of the literature on what I thought was really happening. And they I think they believed enough. They thought, okay, we'll give you let's let's go and try to demonstrate this. And had the fortune of working with others at the Family Violence Research Lab in New Hampshire, who gave me access to some data, and it worked out almost exactly as I had predicted, about 40% or so. So from 1 year, this is not really the most intense violence that we see reported in the media, but it tells you that our assumptions about this is that we have our capacity to intervene and to do something are less than what we really had, and the same is true for domestic violence as is true with any other form of violence. We know that violence is preventable, and we know the things that need to be done. Thankfully, the as the CDC has pointed out, the risk factors, those variables that contribute to an increased probability of the violence to occur, are the main risk factors are shared through all different forms of violence: child abuse, domestic violence, community violence, gun shooting, stalking behavior. They're not identical, but they are shared. So if you are working on one area, so the folks who are listening to this, if you're working any of these areas related to violence prevention, you are helping prevent violence in all areas. This is that is actually how we work at the Melissa Institute. That's why we are comfortable doing a training in trauma informed care with the state attorney's office, or going into Homestead, which is also happened a few minutes before you call in. They call in, they say, can you come and work with this organization that works primarily with migrant farm workers? So yeah, we'll go there and train you there too, because this is what we think it needs to be, from the ballroom to the kind of like to the bedroom, and all the way to the community rooms that needs to be discussed.
Yeah. Oh my goodness. The community work, and being able to be in the community to be able to inject all of this is obviously something that is just woven through everything that we've talked about today. And I'm also passionate about that. It's about reaching the masses, and you're definitely doing that. And it's so exciting to hear. There's so many other questions I have for you, but we don't have enough time. But what I do want to ask you is one of our last questions, and that is, we always ask individuals who have lived experience what recovery means to them. But I would love to hear, not only as somebody who may have lived experience, but also as a provider, as a clinician, as an administrator, what does recovery mean to you?
And I used to talk to the clients that I work with, their families, individuals. Doesn't matter that it was could be one, a couple, or the family. Uh, about really what would a life worth living was look like for them, you know. And and in that context, I would talk. Let's say I was meeting with you, and I would talk about your role as a woman. I would talk about your role as a sister, as a daughter, as a mother, as a partner, as a psychologist, as a name, and as a professional in other areas. And I basically, in all those domains of significance in your life, like go through them. What is it life worth living in that domain? What is it like? Because I think we torture ourselves sometimes by not having, when one of those dimensions of life is not really working the way we want. We put too many of our eggs in one basket.
One domain, yeah, yeah.
So I would really literally sometimes tell people, if they, you may have been dealing with a very difficult marital situation, but you had two kids, and you're thinking, well, I had it. I think we need to divorce now. And you've been together for 20 years, but and I wasn't the type of therapist that was like, yeah, women's rights, you need to go. I actually wasn't. I was like, well, you know, let me see what, because as far as I know you, your definition as a mother is perhaps the most important one that I had, and I'm dealing with this. So I want to know how this fits in with that, and and then I would invite people to really not do anything about that pressing concern until we make sure that all the other domains that are less anxiety provoking were really in order. Because my argument was that it's a lot easier to deal with the difficulties in life from a position of strength, from a position of weakness. So I didn't want you to be making a decision about your marriage, if in fact other parts of your life were also shaky right now. Perhaps we could deal with the stability at work. Perhaps we could deal with your relationship with your sister. Perhaps we could deal with other things. And once you felt satisfied, said, now from that position, do you want to deal with this? Frankly, I would say maybe half of the time. When people got to that point, they said, nah, I don't need to deal with it.
Yeah.
So it's not perfect. So he isn't, he's this or that, or but he's the guy that I fell in love 20 years ago, and he's a great dad. Is my kids love him. I mean, so the conversation changed. I mean, I'm putting aside things like violence. I wouldn't really put together tolerate things like that. But I'm talking about, which this ties up with one thing that I don't want to give the impression, when you are an advocate for social justice, see, and considerations and the importance in clinical practice, I think is also you have a responsibility also to understand that belonging to groups that have been oppressed does not really grant you righteousness. And that is very difficult. I mean, I don't want to sound reactionary, but I'm telling you, as a Puerto Rican Latino psychologist, who's that, it's I cannot speak for the whole population to begin with. So, but also, it's sometimes we are unable and inarticulate to deal with that part too. Not only that we don't know the isms, but then when we find people who can clearly articulate what it's like to live under those isms, we assume everything to be as told. And I think there's a healthy skepticism that needs to go in consuming that, as well as I'm not saying denying. People need to be supported, but when you're working with clients, you don't necessarily want to assume a position that really takes responsibility away from things that they need to do now, family, for their well-being, for the children. I hope that it's a complicated conversation. We can have another conversation about that altogether. But
I mean, yeah.
at least I wanted to mention it because it is something that, and I used to spend quite a lot of time when I was teaching directly our students on this. It was hard. It was hard because they were younger. The last few years that I taught, the students were a lot more. The right word is not radical because they're not radical. They were a lot more educated.
Mm-hmm.
They were really and more willing to jump to conclusions that to me were not justified by the data. And when I asked them to use research to support their argument, they weren't happy sometimes.
Sure.
They're like, I thought you were on my side. I thought you were on my side. Why are you doing this? Anyhow, so.
Yeah. Wonderful. Wonderful. So then to that end, recovery as a provider, as an administrator, what does recovery mean to you?
Yeah. So recovery for me is to really find to strive in an intentional manner to a place of balance. I mean, and not in any hierarchical order, but where your individual, relational, and community needs and aspirations are firm and realized to some extent, and in an intentional manner. You can recover unintentionally too. Some people win the lottery and all of a sudden they recover from many things.
Right.
but so I guess recover, in that capacity to feel. To me, also, when I think about addictions in the area of recovery, the issue of confidence in the choices and decisions and that you're making, I think, is critical because self doubt is intense. When you've been down, when you know what it's like, and you're trying to avoid going back there again. So I think I like to, when I work day in and day out as a clinician, spend more time on the building of strength and then really the avoiding of the falling down, even though I do recognize it very well that there are some things that you need to, if you want to stop drinking, don't have booze in the house. There's just some things that then start by that, and that we move in other direction. But does that answer your question?
Yeah, absolutely. No, it's great. Definitely multifaceted and wonderful answer. So thank you. Well, thank you so much for coming and joining us. I know this isn't going to be the last time. There's so much more we can talk about, and so much more that I want to share. We will include everything with the Melissa Institute. But really quickly for our audience, can you let people know where they can visit, what they can do to get involved, or to even just have resources in their hands with the Melissa Institute and from the Melissa Institute?
Yeah, so we have a website that is, we have three websites, but the main website with information and materials is www.melissainstitute.org. And you can also find us in Instagram. And we don't tweet too much or X too much, but we're there. And and through the Melissa Institute website, you get access to all sorts of free materials, as well as you can get access to us. If you want to, we like to say to folks that if you can dream it, we can help making it happen. So if you have ideas or trainings or things that you think, we will be, more than happy to hear about it. One thing that people should know, and I think we mentioned to you earlier in an earlier conversation, is that our main asset at the Melissa Institute is a group of scientific advisors that are internationally renowned for their amazing work and their dedication to make the world safer and healthier for all. So this is I speak with more confident than I should about these things, but it's because all of them I feel them behind me. So if you have any requests, any questions, and then I could just pick up the phone and call them and say, listen, we got somebody they are trying to do this in Iowa. What do you think? Can we do something like that? And almost 100% of the time they said, oh, Do I know somebody there? Let me tell you, we can, So that's really how we work.
All about the connectedness. I love that. I love that the West Institute gives that. So thank you. It's wonderful.